A spike of confirmed HIV cases in Manitoba has advocates calling on the provincial government to act quickly, as according to one report by the Manitoba HIV Program, the rate of new cases grows to 3 times higher than the national average.
We need a provincial-wide strategy for Indigenous people around HIV and STBBIs.
Albert McLeod is the director of Two Spirit Consultants of Manitoba. At a recent Winnipeg rally held by advocacy group ACT UP Manitoba, he said the spike is a product of systemic anti-Indigenous racism.
We need our government, whether it's Liberal, NDP, or Conservative, or whichever government, to understand this is a global pandemic of HIV, and it's been around for 40 years, and it should not still be happening in Manitoba. We're a first world country, we have tons of money, and yet what's been given around safe injection, harm reduction, and HIV is a drop in the bucket.
The report, called the Manitoba HIV Program Report, shows that people living with HIV in the province grew 52% between 2018 and 2021. And 73.4% of people referred to the Manitoba HIV program self-identified as Indigenous. According to the report, the most common ways for acquiring HIV was through heterosexual sex and injection drug use due to needle sharing. Thomas Linner, the provincial director for the Manitoba Health Coalition, says the HIV spike is a public health emergency.
More than one person a day dies of an overdose in Manitoba. Just about every day, another person is identified as being HIV positive. We need to take real concrete action to address this public health emergency, and the game playing by this government has to stop.
A provincial spokesperson said they are aware of the increasing HIV numbers and that taking action is a top priority. They state they are continuing to invest in several initiatives, including provincial funding for an Indigenous-led testing and treatment program for urban Indigenous people in Winnipeg. Advocates demand for funding for province-wide HIV awareness and prevention, like supervised consumption sites.
You need the prevention tools, the harm reduction tools in place if you know there are cases of HIV, whether you're rural, urban, northern, remote, or unreserved, right? That message has to get out there. And you can drive from Winnipeg to Thompson, you're not going to see a poster about HIV prevention, right? So it's that attitude of that it's no longer important is false, and we need to get the message out there.
Sav Jonesa, APTN National News, Winnipeg.